Alright, this is healthcare bill in part number 35, and I'm going to scroll down just a bit here. Now, if you want to see where we're at, just go back to healthcare bill part number 34, and you will see exactly where we are. This is about what they mean by plan notice is, if you remember in the last video, I was talking to you about the alternative method where maybe the dental and vision is automatically covered the very day you enroll in your health insurance, but say they put a pre-existing condition on your heart disease. They have to tell you that the very second you apply for this health insurance. They can't say, well, I don't tell you that. They have to tell you that at the time you... Now, the difference between the plan notice here and the issuer notice here is that this is for companies that provide you health insurance. This is if you're buying health insurance on your own. Okay? Now, they also can't give you vague dates. They can't say, well, this pre-existing condition is going to exist for approximately a year. They have to say, your pre-existing exclusion starts on X and Y date and ends on X and Y date. They can't play games with you on this. Now, there are certain exceptions to the pre-existing condition thing. And you'll have to check with your insurance companies on this. I just don't know. The first one was certain newborns, adopted children, and definitely not pregnancy. If you're pregnant, it doesn't matter when you enroll in your health insurance. That's not a pre-existing condition. You're pregnant, you're automatically covered. Very first day that you enroll in your health insurance, you're covered. Okay? Alright. And I don't know what this loss of break-in coverage is. If you guys can figure that out, that's great. Leave me a comment down below. Alright, let's read this together here. It says, certifications and disclosure of coverage, requirement for certification of period of credible coverage. A group health plan and health insurance issuer offering group or individual health insurance coverage shall provide the certification described in subparagraph B. At the time an individual ceases to be covered under the plan or otherwise becomes covered under a COBRA continuation provision. So they have to establish a certification period of credible coverage between the time you lose your coverage and the time you're covered under COBRA, or the time you lose your coverage and you're covered under the health plan again. And it just says, basically, between the time that you lose your coverage and you're under COBRA, the time you lose your coverage period, or on this one here, you can request it yourself. You can request the certification yourself, and you have to make the request no later than 2 years after the ending of your coverage described in Clause 1 or Clause 2, whichever is later. The certification under Clause 1 may be provided to the extent practicable at a time consistent with notices required under any applicable... Alright. The certification described in this subparagraph is a written certification of the period of credible coverage of the individual under such plan and the coverage, if any, under such COBRA continuation provision. So basically what I'm getting out of this is you can actually show your health insurance that you had credible coverage prior to being re-enrolled. Okay? And you can get this proof from your COBRA plan or from your health insurance, believe it or not, that you got out of in the first place. Alright? And that's what this is all talking about here. And if you have any comments, leave them down here below. I'm willing to listen to them. And that's about all I'm going to cover in this particular video. I will cover some more later on. I will tell you more in a future video, so stay tuned.